Hello everybody who have been ever suffering from epilepsy or who have relatives, friends suffering from epilepsy. I am Dr. Koushik Dutta, a neurologist based in Kolkata. So this is a part of the Purple Month initiative, and we are trying to break some of the myths and trying to help the patients and relatives who have some problem with epilepsy to help them out so that you can have a proper treatment and better quality of life. Who has been ever suffering from epilepsy and who ever know anybody who has been suffering from epilepsy. This is a part of the Purple Month initiative where we are trying to break some of the myths related to epilepsy and trying to help the people who are suffering or who know very close friends or relatives suffering from epilepsy. Epilepsy is a neurological condition. It's the third most common neurological condition. It's very much treatable. The problem is the dramatic presence and presentation of epilepsy has led to a lot of supernatural myths being tagged with epilepsy, and most of the people in history have been neglected, rejected by the society and not treated at all. Many of them could have had a very good quality of life if they ever took treatment for epilepsy. At least in the modern era when we have excellent drugs and non-medical treatment for epilepsy. So what is epilepsy? First, let us know what is a seizure. A seizure, we commonly know that is a form of convulsion that the people may have, but there can be non-convulsive forms of seizures as well. So a seizure is basically an abnormal discharge in the brain which may present with various sorts of manifestations. The commonest form is convulsions, which 60% of the epileptic patients will have. The others may have simple loss of consciousness, transient behavioral abnormality, some abnormal movements of the face, say someone is chewing like this. These sort of chewing movements. Someone may just lose touch with the surroundings. We very commonly have children with absence seizures who are just marked as unmindful in the class. So these can all be manifestations of epilepsy. Whenever you have a person with sudden abnormal behavioral manifestations, abnormal loss of consciousness, or any sort of abnormal movements, whether convulsive or just a limb ticking like this. So all these patients may have epilepsy and they may benefit from the treatment. So the person who has epilepsy needs to be diagnosed properly first, whether it's an epilepsy or something mimicking an epilepsy. So what is the chance of you having a seizure and what is the chance of you having an epilepsy? If a person lives up to say 80 years, there is 5 to 10% chance that the person will have at least one unprovoked seizure in his or her life. So an epileptic seizure has to be unprovoked. You have one single seizure during fever, that is not epilepsy. So even if you have one unprovoked seizure, that may not be epilepsy. As a standard, we count at least 2 unprovoked seizures as an epilepsy. So the chances that you will have an epilepsy after a seizure depends on other factors which the doctor will diagnose for you. But once you have a seizure, please visit any of your nearby doctors who can start treatment with you. So what are your chances of getting well? If you are diagnosed properly and if the epilepsy is classified properly, whether it's a primary generalized seizure, a partial onset seizure when the person may have ticking of one hand, one leg, these are all partial onset seizures, focal seizures. The people who have aura, there is an abnormal sensation prior to onset of the convulsions, they also have partial onset seizure. So if this classification is done properly and drugs are chosen appropriately for the type of epilepsy you have, then there is about 50% chance that you may be completely well with one drug the first drug you have may cure your condition or at least control it completely. For the other half of people who may not be controlled on the first drug, with the second or third drug trial, there are chances that you may become better with medicine alone. For the people who won't be completely controlled with medicines, even with them there are chances that at least your seizure frequency will be reduced by 50 to 70% and you will have less severe seizures. So if your chances were that you have severe seizures and break your limbs, face accidents, you are losing your job, you are losing your studies, everything, so that severity and frequency will come down and will have a better quality of life. For about a third of patients who may be medically refractory, for them also we have excellent surgical treatments and other forms, modalities of treatment which may be beneficial for them also. So finally the chances are that you will have a much good quality of life than you had previously. You can save your job, you can save your family, you can save your studies and have an excellent quality of life with proper treatment. And for a good number of people, after about say 2 to 3 years, it may be possible even to withdraw the drugs. You may become drug free, completely free from epilepsy and drug free. It may not be possible for all epileptic patients, but for a percentage of patients it may be possible to withdraw the drugs completely. So the first thing is to get rid of the myths surrounding epilepsy. It's not a curse, it's a disease, it's a neurological disease, it's a highly treatable disease. For some people it may be completely curable, for others it's at least very much treatable. So with this, I wish you a myth-free and epilepsy-free life with proper treatment, and I wish you good luck. So please go for science, stand by yourself and enjoy life to the fullest extent possible for you. Thank you.